Okay, so imagine this. A mineral, right? Super fundamental, plays a huge role inside your pet cells, second only to potassium. And then suddenly it turns from being essential to, well, potentially hazardous. That's the puzzle we're diving into today. Hypermagnesemia, basically high magnesium levels in our dogs and cats.
Exactly. We're talking about serum magnesium going above roughly 2.5 milligrams per deciliter in dogs and 2.3 in cats. Now, the source we're looking at, veterinary hypermagnesemia. Diagnosis and treatment. It does say this is often considered, less clinically significant than low total body magnesium.
Sure.
But, and this is important, elevated levels can definitely still cause some pretty serious problems, even life-threatening ones for pets.
Absolutely. So our mission today, as we unpack all this, is really to give you a clear picture. What causes magnesium to spike? What are the signs you should look out for? And crucially, why spotting it early matters so much. We'll try to cut through the jargon, give you the essentials.
Right. Let's start with magnesium itself, the basics. It's super abundant in the body. Actually, the second most common positively charged ion inside cells, right after potassium. You find most of it in bone and muscle tissue. And it's just essential for a whole host of metabolic functions.
Okay, let's dig into that a bit. The source mentions that in the blood, it exists in a couple of forms.
Yeah, that's right. About 25 to 30% is bound to proteins. The rest, so 70 to 75%, is either chelated, meaning bound to other small molecules, or it's in its free ionized form. And that ionized form is the really active one.
Gotcha. And how do they get it? Absorption happens where?
Primarily in the ileum, that's the final section of the small intestine, though some absorption happens in the jejunum and colon too. But here's where it gets really key biochemically. Magnesium is a cofactor, like a little helper molecule, for something called the sodium-potassium ATPase pump.
The sodium-potassium. Okay, hang on. Biology class feels like a long time ago. Break that down for us.
Sure. Think of it like a tiny pump in the wall of every cell. Its job is to keep pumping sodium out and potassium in. This maintains a really specific balance, an electrical gradient, which is fundamental for nerves and muscles to work properly. Magnesium is kind of like the oil that helps this pump run smoothly. So if magnesium levels get too high,
It messes with that pump and the electrical balance.
exactly, it disrupts those gradients. And as the source points out, that disruption is what ultimately leads to the neuromuscular and cardiac problems we started talking about. It's all about that balance.
Okay, so how does the body normally keep that balance? You mentioned the kidneys.
Yes, the kidneys are the absolute stars here. They filter the blood constantly, and they reabsorb magnesium back into the body as needed. Our source details this pretty well. About 10–15% is reabsorbed in the proximal tubule, then a big chunk, 60–70%, in the thick ascending limb of the loop of Henle, and another 10–15% in the distal convoluted tubule.
Wow, that's a lot of places it gets pulled back in. What controls all that?
Good question. Hormones and neurohormones fine-tune that last stage of reabsorption, the distal tubule. That really determines the final amount that ends up in the urine. But here's the crucial link. If the kidneys aren't filtering properly, if the glomerular filtration rate, or GFR, is severely down.
GFR, that's basically how well the kidney filters are working, right?
Precisely. If that GFR is way down, the body just can't get rid of the excess magnesium efficiently, and that's a primary cause of hypermagnesemia. The kidneys can't eliminate it.
Okay, makes sense. Bad filters means stuff builds up.
Yeah.
So what are the specific effects? What does this excess magnesium do?
Right, it's like a domino effect. We mentioned it messes with nerve signal transmission. It dampens the response at the neuromuscular junction where nerves talk to muscles. There was actually a study mentioned in anesthetized dogs. Cardiovascular effects didn't really show up until plasma levels got quite high, over 12.2 MEQL, and fatal heart rhythm issues happen at even higher doses.
Sounds pretty serious. The source also calls magnesium nature's calcium blocker. What's that about?
Yeah, that's a great description, because probably the most dangerous complication of high magnesium is how it antagonizes or blocks calcium, especially in the heart's electrical conduction system. Think of it like magnesium interfering with calcium's job and keeping the heart beating regularly. That can cause major cardiovascular problems. So yeah, the systems mainly hit are cardiovascular, musculoskeletal, and nervous.
Okay, but how common is this? Are we seeing this in lots of pets?
Well, interestingly, the source cites figures from hospitalized pets. It showed up in about 18% of cats and 13% of dogs studied. But, and this is key, the vast majority of those animals also had underlying kidney problems, either renal insufficiency or something called post-renal azotemia, where urine flow is blocked after the kidneys.
So again, it really points back to kidney health being a major factor. Okay, as a pet owner then, what signs might make you think, could this be high magnesium?
Well, because it's so often tied to kidney disease, You might first see signs of that, like drinking more, urinating more, maybe poor appetite. But as the magnesium level itself climbs, you can see this sort of progressive loss of function. Neuromuscular, respiratory, cardiovascular. Specific things to watch for can be nausea, vomiting, just general weakness, a slow heart rate that's bradycardia, maybe even flaccid paralysis, seeming mentally depressed or dull, and decreased reflexes.
Those definitely sound like get to the vet signs, and I guess it can get worse.
It can, yes. With higher levels, you might see low blood pressure, hypotension, and specific ECG changes. Things like delayed electrical signals in the heart, a prolonged QT interval. The source uses human data for context here, but it's sobering. Levels above 16 milli-GDL in people have been linked to things like AV block in the heart, breathing depression, coma, even cardiac arrest.
Okay, clearly kidney failure is the big one. What other things can push magnesium levels up?
Good question. Besides renal failure, the source lists a few others. Things like really sluggish intestines or constipation that can reduce how much magnesium leaves in the feces. Certain hormone disorders, too, like hypoadrenocorticism, that's Addison's disease, hypothyroidism, and hyperparathyroidism. Also, interestingly, using certain heart medications together, specifically ACE inhibitors and spironolactone. And then there's just giving too much magnesium, maybe in cathartics used with activated charcoal or laxatives, or even in fluids for peritoneal dialysis. This is especially risky in animals that already have kidney issues. Sometimes it can even be, well, iatrogenic, meaning inadvertently caused by treatment, like over-supplementing a kidney patient.
Right, so thinking about risk factors, it sounds like it comes back to kidneys' gut motility.
Yeah, largely mirroring the causes. Pre-existing kidney disease is number one, but also pets with slow gut movement, massive red blood cell destruction hemolysis. Those endocrine issues we mentioned, Addison's, hyperparathyroidism, and again, that ACE inhibitor spironolactone combo. And definitely overuse of magnesium laxatives, especially if kidney function isn't great.
So when the vet suspects this, how do they pin it down? Do other conditions look similar?
They do, absolutely. The signs can definitely overlap with low calcium, hypocalcemia, and our source points out these can actually happen together. Plus, that slow heart rate, bradycardia, has a lot of other potential causes. Neurologic disease, hypotaxium, high blood pressure, hypothyroidism, certain heart rhythm problems like sick sinus syndrome, even some drugs. So ruling those out is part of it.
And the lab work, what's the key test?
The main thing is measuring the serum magnesium level itself. Like we said, over 2.5 milli-GDL in dogs, 2.3 in cats. It's also pretty common to find low calcium alongside it. And often you'll see signs of azotemia, those waste products, especially if the kidneys are involved.
The source also mentioned some things that can mess up the lab results. That seems important for interpretation.
Oh, definitely. Accuracy matters. Generally, serum is better than plasma because some anticoagulants in plasma tubes, like citrate, can bind magnesium and give a false low. Other things giving false lows can be EDTA, sodium fluoride oxalate, sodium citrate tubes, and even if the pet recently got IV calcium gluconate. On the flip side, hemolysis broken red blood cells in the sample can give a false high because red cells have way more magnesium inside. Even storing the sample in metal containers can raise the reading. And weirdly, high bilirubin levels can sometimes cause a false low. So yes, the vet needs to consider all these possibilities, and these tests are generally considered reliable when run in human labs too.
Are there other, maybe more specialized tests?
Yeah, sometimes. While the standard serum level is usually the go-to, a vet might measure ionized magnesium, the active form. That needs special equipment. Less commonly, they might measure magnesium inside certain blood cells or do a loading test to see how the body handles extra magnesium. And things like ECGs and electromyography, they show the effects of high magnesium on the heart and muscles, but not the cause itself.
Okay, so we found high magnesium. What's the treatment plan look like?
Right, the main goals are twofold. Get rid of the excess magnesium and manage the symptoms supportively. First, absolutely critical. Stop all magnesium-containing meds and supplements immediately. To boost elimination, saline diuresis is common, basically IV fluids, to make the kidneys produce more urine. And loop diuretics like furosemide. They work by reducing magnesium reabsorption back in that loop of Henle part of the kidney.
And the supportive care part.
That usually involves IV fluids, often 0.9% sodium chloride, especially if the pet is dehydrated, has low blood pressure, or has that waste product buildup, azotemia. In really severe cases, if the pet isn't making much urine, peritoneal dialysis might be needed to filter the blood artificially.
The source also brought up using calcium in treatment. Seems a bit odd if magnesium is high.
Yeah, it sounds counterintuitive, doesn't it? But it's a really good point. Giving calcium, usually IV, directly counteracts magnesium's bad effects. It can help reverse the breathing problems, the heart rhythm issues, the low blood pressure seen in severe cases. And bonus, calcium actually helps the kidneys excrete more magnesium. So for severe cases, we might use 10% calcium gluconate, given carefully, slowly, often diluted IV, or sometimes under the skin. For milder or longer-term situations, oral calcium might be an option. Though the source does note that if the high magnesium is just from that ACE inhibitor spironolactone combo, it's often mild and might not need aggressive calcium treatment.
What about nursing care for these pets? Sounds like they might need quite a bit of support if they're showing signs.
Oh, absolutely. If there are neurological signs like weakness or dullness, intensive care is really important. You worry about things like aspiration pneumonia if they can't swallow well, collapsed lungs, pressure sores from lying down, skin scalding if they're incontinent. Diet-wise, obviously, stop all magnesium supplements. And educating the owner about any underlying conditions is key. Activity is usually restricted based on how they're doing, and it goes without saying, no magnesium-containing fluids or compounds, and definitely need to watch the ECG closely during any calcium infusion.
Okay, so after treatment starts, what's the follow-up like?
You need close monitoring, checking serum magnesium and calcium levels frequently, watching kidney function, those waste product levels, how much urine they're making. Continuous ECG is great, if possible, especially early on or in severe cases. Prevention-wise, the big takeaway is just being really careful with magnesium supplements in any pet known to have kidney issues. And we have to remember, severe hypermagnesemia, especially with low calcium, can be fatal. The source did mention that hypermagnesemic dogs had significantly lower survival rates. However, if it was an iatrogenic cause, like an accidental overdose during treatment, the outlook can be good if it's caught quickly and managed well.
Right. So let's wrap up this deep dive. High magnesium, hypermagnesemia, it can be really serious in dogs and cats, often tied to kidney problems, as we've heard. It causes a whole range of nerve, muscle, and heart issues. And spotting it early, treating the underlying cause, that's absolutely vital.
That sums it up well. And hopefully now you, listening, have a much clearer picture of this electrolyte imbalance, what causes it, what it looks like. That knowledge really helps you have better conversations with your vet if it ever comes up. You know, this strong link between kidney function and electrolytes like magnesium really highlights why even small changes in kidney health can have big ripple effects. Makes regular checkups, especially for older pets, seem even more important, doesn't it?
It really does. And maybe a final thought to leave you with. We've seen how finely tuned this one electrolyte, magnesium, is. It makes you wonder, doesn't it? What other, maybe seemingly minor imbalances could be having surprisingly big effects on our pets' overall health? What questions does this deep dive spark for you about being proactive and really understanding your own pet's unique needs?